Check. You check. Mirror check.
Hi,
Hi, my name is Ling. I'm a nurse practitioner student. How are you?
I'm good. How are you?
I'm good. So before this visit, I just want to ask for your permission so I can ask for you for your medical history, family history. I'm gonna conduct a physical assessment, so I may touch you and have you do some tests. Is that okay?
Yes.
And for training and education purposes, I'm gonna record this visit. Okay?
Okay.
Can you please let me know your full name,
Bella Hall.
your race,
Asian.
your gender?
Female.
How is your pronoun? She, hers. Thank you. Your date of birth?
April 21st, 1998.
Thank you. What brings you to the clinic today?
I'm here for the physical exam for my new job, and I also having lower back pain.
Oh, I'm sorry about that. When did the back pain start?
5 days ago.
What happened? Why did it start?
So I'm moving right now, so that's why I have to carry a lot of heavy boxes.
Okay, I see. How do you rate your pain from 0 to 10?
3.
Okay, what makes the pain worse?
Like do exercise, weightlifting, and also moving around.
Okay, I see. Do you know if the pain radiates to other parts of your body?
No.
Lower feet? No. You take anything for your pain? Any medication?
Tylenol 2 regular tablets every 8 hours.
Every 8 hours. Thank you so much. Do you use any other method like heat and cold?
No.
Do you know if the pain interferes with your daily activity?
No.
Does it interfere with your sleep?
No.
Thank you so much. So, when was your last physical?
Last year, 2022, November.
November. Is there any abnormal finding?
No.
Okay. Do you have any chronic conditions such as migraine, headache?
No.
Do you have any issue with your like mental, like depression, anxiety?
No.
Do you have any infectious disease, say tuberculosis or hepatitis? You have any allergies to medication?
No.
And are you taking currently any medication besides the Tylenol?
I'm taking women probiotic, 1 tablet per day.
Thank you so much. You have any past surgery procedure?
No.
Any past hospitalization because of injury or trauma?
No.
Do you know if your immunization try boost is up to date?
Yes.
You have flu vaccine of this year?
Yes.
You have a COVID booster?
Yes.
How many booster you have?
2.
When was your last menstrual period?
November 25th.
Usually how long is your cycle?
5 days.
You have any pain during the cycle?
Yes. Cramp, and I usually have very heavy on the first 2 days.
The first 2 days?
Yeah, that's why it's cramp and painful.
You take anything for your pain?
Tylenol as well, 2 regular tablets every 8 hours.
Okay, thank you. Are you currently sexually active?
Yes.
You have a boyfriend, partner, girlfriend?
Boyfriend, my first one.
First one, you have only one sexual partner. Do you use any contraceptive method?
We use condom.
You have any history of STD?
No.
Any pregnancy plan?
No.
Do you do breast exam every month?
I do it, but I'm not so sure that I do it correctly.
Yeah, so you do the breast exam every month, usually same day, the first day of your period, right? And then you do it on the 3rd or the 5th day. At that time, your breast is not tender, and you compare bilaterally if you detect any abnormal lump. So you let your medical advisor know, okay?
Okay.
Okay, regarding your family history, so your grandparents on your dad's side, do you know if they have any health condition?
So my grandpa now is 82 and he has high cholesterol, and my grandma is 80 and she has high blood pressure.
Okay, and your grandparents on your mom's side, do you know if they have any health condition?
My grandpa from my mom's side, he died from the car accident.
I'm so sorry.
60. And my grandma is right now 75, and she is healthy.
Thank you. Do you know if your parents have any health condition?
No.
You have any sibling?
Yes. Older sister and younger brother.
Do they have any health condition?
No.
Okay, so next I'm gonna ask a lot of past medical history about all the family member that we just mentioned.
Yes.
Okay, all the people that we mentioned, do you know if they have any health problem,
No.
any eyes problem,
No.
such as vision detachment,
No.
any ear problem, any ear surgery?
No.
Do you know if they have any abnormal heartbeat,
No.
any past medical of stroke,
No.
myocardial infarction?
No.
Do you know if they have any respiratory issue like coughing,
No.
any history of tuberculosis?
No.
Do you know if they have any GI issue like GI bleeding,
No.
any Crohn's disease, diarrhea?
No.
Do you know if they have any bladder disease,
No.
any history of kidney disease?
No.
Do you know if they have any joint disease and
No.
any bone issue
No.
or disease? Do you know if they have any history of colon cancer,
No.
any breast cancer?
No.
Do you know if they have any history of diabetes,
No.
any history of hypothyroidism?
No.
Do you know if they have any history of obesity?
No.
Do you know if they have any history of mental health like anxiety,
No.
depression?
No.
Do you know if they have any history of genetic disorder like Down syndrome?
No.
Do you have any history, if they have any history of substance use
No.
disorder, alcohol?
No.
Do you know if they have any allergic reaction history?
No.
Okay, thank you. Do you know if they have any neurologic disorder like dizziness, abnormal
No.
gait?
No.
Thank you so much. What is your place of birth?
Vietnam.
And you mentioned you're Asian. What is your nationality?
Vietnamese.
Yeah, and your ethnicity, you're not Hispanic,
No.
Asian. What is your marital status?
I'm only dating right
Yeah.
now.
What is your occupation now?
Research associate for drug
Mhm.
discovery and
Thank
development.
you. Have you ever been in military?
No.
Do you have any financial problem where you have to
No.
pay a lot of loan?
No, I don't have loan. I make enough for my living and my rent.
Thank you. Do you think you have a strong social support?
Yes.
You exercise?
Yes. 45 minutes,
Mm-hmm.
5 days per week.
Okay. And how's your diet?
Vegetarian.
Do you drink caffeine?
Yes, 1 cup per day.
Do you smoke?
No.
Do you vape?
No.
Do you drink alcohol?
1 or 2 drink per week.
You use any illicit drug?
No.
What is your hobby, leisure you do at your free time?
Hiking, kayaking, and cooking.
That's why I love to cook too.
Okay.
How's your emotion? The general emotion, where you feel happy, you feel pleased with your life?
Yeah.
Do you have stress?
No.
Do you have any trouble sleeping?
No.
Do you feel safe at your living situation? Do you feel safe at your workplace?
Yes.
Do you have fever,
No.
chill,
No.
malaise,
No.
loss of appetite,
No.
weight loss?
No.
Do you have any eyes issue like
No.
blurred vision, double vision,
No.
bloater?
No.
When was the last time you go to the eye doctor?
I never.
You don't have any problem? Yeah, so it's okay. You have any ear issue, any pain, drainage?
No.
You have any nose issue like runny nose, difficult smelling?
No.
Do you have any mouth issues such as difficult chewing, pain
No.
when chewing,
No.
any lesion in your mouth,
No.
any difficult swallowing?
No.
You have any heart issue like abnormal heartbeat,
No.
chest pain, shortness of breath?
No.
Do you have cough?
No.
Do you have any lung disease?
No.
Do you have any GI issue? What is your normal bowel pattern
Every day.
every day? And how's the stool?
Soft and yellow brownish.
You have diarrhea, constipation?
No.
You have any difficulty urinating?
No.
Any pain or burning sensation when you urinate?
No.
You have any dry skin lesion
No.
issue? How's your breast? Do you have any lumps that you
No.
newly detected? Do you have any joint issue?
No.
Any joint stiffness?
No.
Do you have any dizziness? Difficult with walking?
No.
Any muscle weakness?
No.
Do you have any? Do you notice any that you bruise easily?
No.
When you bleed, it's hard to stop.
No.
Do you notice any weight gain?
No.
Any weight loss?
No.
Do you notice that you get sick easily?
No.
Here. Do you have any allergic reaction?
No.
Any immunologic reaction?
No.
Here. So next I'm gonna start my physical examination. I'm gonna start with the general survey. So Bella sits comfortably on the exam table, no distress. She appears pleased. Her clothing is tidy and clean. No abnormal odor. Her posture is good. No difficulty maintain posture or no difficulty in mobility. Bella is alert and oriented with person, place, time, and situation. Bella height is 5'5", weigh 115 pounds. Her MBI is 20.4. That's healthy and normal MBI. Vital sign: blood pressure 110/62, heart rate 62, respiratory 16, oxygen saturation 99 on room air, and temperature 97.9 Fahrenheit. And that's normal, healthy vital sign. Next, I'm gonna inspect for the skin, hair, and nails overall. Bella's skin is, after inspection, I appreciate Bella's skin is intact, warm. The tuber is elastic. No lesion. I don't appreciate any lesion. I don't appreciate any pallor, jaundice, erythema, pruritic of the skin, and the hair and nails. I don't appreciate any cyanosis, nails blocking, tar staining of the nails, and the hair is well distributed. The hands is dark, pigmentation originally, no visible hair loss, no lesion, and I don't appreciate any scar, vascular or pupillary lesion or superficial tumor or nervy. Bella, do you notice any mole on your skin that getting bigger
No.
by time? I don't appreciate any skin lesion that's hair asymmetry, shape, irregular border, dark or strange color with large diameter, and the patient don't report any abnormal evolving of the skin lesion. And next I'm gonna check Bella's head. The head is round, symmetrical, normal facial expression, no edema. I'm gonna palpate the head. No tenderness, no depression. Hair is well distributed, thin and straight. Do you have any pain or tenderness?
No.
I'm going to palpate with a temporal artery pulsation. Temporal artery pulsation 2+, normal rhythm, equal bilaterally. I'm going to check for the temporal mandibular joint. Can you open your mouth for me and close? The TMJ is smooth. When she open and close, I don't appreciate any click when palpation. And can you please close your eye? I'm going to check for the trigeminal cranial nerve 5. Let me know it's soft, dull, or sharp.
Soft. Dull. sharp, soft.
Okay, try to open your mouth. Cranial nerve 5 is intact. Can you front your forehead? Puff up your cheek. Smile. Cranial nerve 7 facial is intact. Now I'm gonna check for your eyes. Symmetrical. No abnormal lesion. Abnormality. You're gonna look up, look down, to the left, to the right. The eyelids, no abnormality in the eyelids. I appreciate the moist and pink conjunctiva. The sclera is white. No foreign body. The cornea is clear. The eye, no abnormality in the iris. I'm gonna check for the pupil reaction. I'm gonna look straight, okay? I appreciate the pupils are round, reactive to light, equal, and the pupils are constricted consensually. When I shine to the left, the right also constricted. When I shine the light to the right, the left also constricted. I'm gonna check for the accommodation. Can you look to the pen line and look to the wall? Look to the pen line, look to the wall. Bella's pupil constricted when she looks to the pen line and dilate when she looks to the wall, so pupils are accommodated. Now I'm gonna check for the frontal sinus, no tenderness. Maxillary sinus, no tenderness. And then I'm gonna check for the optic nerve. I'm gonna use the pocket chart, fit behind Bella. Can you cover your left eye for me, please? Read it out loud.
L, T, F, B, H.
Now cover your right eye.
L, T, F, B, H.
Visual acuity is 20/20 bilaterally. Can you please cover your left eye? And follow my finger with just the eye. Cranial nerve 4, 3, 3, 6. Cover your right eye. Cranial nerve 4, 3, 3, 6. Cranial nerve 3, 4, 6 are intact. And during the test, I don't appreciate any involuntary rapid and repetitive movement of the eyes, so they're negative for nystagmus. Now I'm gonna check for the retina and the red reflex. Uh, 15 inches away, 15 degrees. When you see the red reflex, I use my right hand, right eye to look at Bella right eye. I appreciate the retina is reddish orange. I appreciate the vessel, the artery smaller than the veins. When I follow the artery and the veins, I can see the optic disc is yellowish orange. Optic disc to cup ratio is 3:1. The macula is the central dark. The fovea is within the macula. I don't appreciate any hemorrhage, cotton body, or detachment of the right eye. I'm gonna inspect the left eye using the same technique. 15 inches, 15 degrees away. When you see the red reflex, I'm gonna move closer to Bella left eye, and the reading similar to the right eye. Next, I'm gonna check for the ears. The ears are symmetrical bilaterally, no drainage, no lesion. I'm gonna pay for tenderness, pre-auricular chagas, and mastoid bilaterally. No tenderness. You have any pain?
No.
I'm gonna check for obstruction for the external ear canal. No obstruction bilaterally. Now I'm gonna test for the whisper test. I'm gonna have Bella cover your right eye for me, please. Cover your right ear for me. And in circular motion. I'm gonna stand behind you. Repeat after me, okay? 3, chair, 6.
3, chair 6.
Now you're gonna cover your left eye. You're gonna sit 2 feet behind. Okay, that's okay. Now repeat after me.
4, room 5.
Cranial nerve A is intact. Now let's check for Webber. Let me know if you hear equally bilaterally or it's
Equally.
louder. You want it equally. Let me know when you stop hearing the ringing.
Yes. Yes.
So Webber midline, the right test in the right ear, AC greater than BC, that's normal finding. Let me know when you stop hear the ringing.
Yes. Yes.
AC greater than BC in the left eye, and that's normal healthy finding. Now I'm gonna check for the nose. The nose is midline symmetrical, not normal, not normality. Before I check the nose, I'm gonna check for the ear. Okay, I'm gonna the hair lifts up and down. Inspect for the ear canal. The flushing color with small hair. I appreciate the Tiffany is pearly gray. I see the mollias come up light is 7 o'clock. I'm gonna change this. And the hair lifts up and back. If you have any pain, let me know, okay? I appreciate the ear canal is flushing, small hair, no foreign body. The Tiffany membrane pearly gray. I see the mollias and the corner of light is 5 o'clock. Next, I'm gonna check the nose. Can you look up for me, please? If you have any pain, let me know, okay? I don't appreciate any lesion, any erythema, any drainage. The mucosa is pink and moist. The turbinates are patent. I'm gonna have you close your eye. Smell for me. What is this?
Coffee.
It's correct. Olfactory cranial nerve ones intact. I'm gonna check the mouth. The lips is pink, no lesion. Can you open your mouth for me, please? I'm gonna check the gingiva. The gum is pink and moist, no lesion, no enlargement. The buccal mucosa is pink and moist, no erythema. The hard palate is the top, the mouth, the bunny part with the white shading. The soft palate is vascular, symmetrical, pink and moist. The anterior and posterior pupilla is vascular, symmetrical, moist. Now I'm gonna check the tongue is midline, no enlargement, no hypertrophy. I'm gonna check for the uvula is midline. Can you say ah? The uvula move up in midline when you say ah. And then check for the get reflex, positive get reflex. Can you swallow? So cranial nerve 9, glossopharyngeal and vagus are intact. Now I'm gonna check out for the hypoglossal cranial nerve 12. Can you stick your tongue out? Now push again my hand. The strength is 5/5 equal bilaterally with resistance. Then I'm gonna check for the neck. Symmetrical, no deformity, no abnormality. I'm gonna palpate the auricular lymph nodes, posterior auricular lymph nodes, occipitus, tonsillar, submandibular, submental, anterior cervical, posterior cervical. I don't appreciate any tenderness, any lumps. Can you open your mouth for me again? I appreciate the tongue show is pink and moist, symmetrical, the tonsil graze two bilaterally. I'm gonna check for the trachea is midline, no deviation. I'm gonna check for the thyroid. This is the thyroid cartilage, and then thyroid gland symmetrical bilaterally and cricoid. Can you swallow for me? I can see the thyroid cartilage and thyroid gland and cricoid thyroid move up. With swallowing, can you swallow for me? I appreciate the smooth contour, no nodule. Okay, I'm gonna stand behind you. Can you shrug your shoulder for me? Accessory, cranial nerve trails are intact. Just gonna block my phone. Okay. And then I'm gonna check for the JBP, the jugular pressure venous. I'm gonna have Bella look, lay down 30 to 45 degrees. Look to the opposite side. I'm gonna check for the pulsation and the highest point of pulsation. I'm gonna mark that point and measure with 90 degrees from the stomach knot. Okay. Then I'm gonna check for the thorax and lung, anterior, posterior. The skin is intact, no deformity, no chest deformity, chest barrel, and I don't appreciate any use of accessory muscle, any retraction or diaphragmatic breathing. The breathing is non-labor. Breathing rate is 16 beats per minute. I'm gonna palpate for the sternum for tenderness. Any pain or tenderness?
No.
And the anterior posterior to transverse ratio is 1 to 2. I'm gonna check your back, okay? Can you turn your back for me? Thank you. I'm gonna palpate for the intercostal space for tenderness and pain. Any pain or tenderness?
No.
Okay. And then I'm gonna check for the lung excursion with some skin fall between my thumbs. Take a deep breath for me, please. I appreciate the rib cages move up symmetrically and the lung expansion is 3 centimeters. Can you say 99 when my hands move around?
99, 99, 99, 99, 99, 99, 99.
Tactile parameters. I appreciate the equal vibration bilaterally with normal intensity. I'm gonna curse in ladder line pattern, and I'm gonna skip the scapula. I appreciate resonance upon person. Now I'm gonna curse for the diaphragmatic expression. I'm gonna have you inhale deeply and hold your breath for a few seconds. When I detect dopeness, I'm gonna stop. You can breathe normally and mark the skin, and then I'm gonna have Bella exhale deeply and hold your breath, please. I'm gonna curse upward until I hear resonance. I'm gonna stop and I'm gonna measure the diaphragmatic excursion is 4 centimeters. I'm gonna use similar technique to measure the diaphragmatic excursion on the left side. Next, I'm gonna auscultate for the lung sound. Take a deep breath for me, please. Take a deep breath. Tracheal lung sound. Take a deep breath for me, please. Break your vesicular lung sound. Take a deep breath for me, please. Vesicular. 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 I don't appreciate any advantages lung sound. Okay, can you please turn towards me? Now I'm gonna palpate for any tenderness of the bronchial tenderness. Any pain or tenderness?
No.
Okay. Now I'm gonna check for lung excursion. Would you please take a deep breath? I appreciate the lung expansion is about 3 centimeters. The rib cages raised equally bilaterally. I'm going to curse. I appreciate resonant percussion, open percussion. I'm gonna listen for the lung sound anteriorly. Opposite of the lung. Take a deep breath from me, please. Tracheal lung sound. Take a deep breath from me, please. Brachial lung sound. Take a deep breath from me. Deep breath. Vesicular. 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 I don't appreciate any advantages lung sound. Next, I'm gonna have Bella lay down on the exam table. So my hands are here, so I'm still in. I'm gonna check for the chest wall asymmetry, no deformity. I'm gonna observe for any hips, lips. I'm gonna palpate for, I don't appreciate any visible hips, lip. I'm gonna palpate. I don't appreciate any hips, lips, and frills. I'm gonna palpate for the carotid. 2 plus, upon brisk, smooth contour. 2 plus, upon brisk, smooth contour, normal rhythm. I'm gonna auscultate for the carotid artery, my diaphragm. My bell, no fluid. I'm gonna auscultate for the aortic area, second intercostal to the right of the sternum. Pulmonic area, second intercostal to the left of sternum. Earthbone, third intercostal space, left of the sternum. Tricuspid area, 4 intercostal space, and mitral, fifth intercostal space with clavicular line. I appreciate physiologic S1 and S2. I don't appreciate any abnormal heart sound or heart murmur. I listen with the bell of the pharynx. I don't appreciate any fluid. We're gonna have Bella sit up so I can auscultate the lung sound when Bella sitting up. Okay. Diaphragm, aortic area, pulmonic area, earthbone, tricuspid area, mitral area. I appreciate physiologic S1, S2. I don't appreciate any heart murmur, the more heart sound. Okay, I'm gonna have Bella lay back on the exam table. I'm gonna have you to unwrap your. I appreciate the skin is appreciate with your appropriate with your affixity. Your abdomen is flat, contour, no visible vibration, no pulsation, no mass, no lesion. When you listen for the bowel sound in 4 quadrant, right lower, up, right upper quadrant, left upper quadrant, left lower quadrant. I appreciate normal active bowel sound 4 quadrant. I'm gonna check for the abdominal aorta. No fluid, renal artery. No fluid. You're gonna check for iliac artery. No fluid. No fluid. Femoral artery. No fluid. No fluid. I'm gonna percuss over the abdominal. Appreciate tympani is predominant in the abdominal. I'm gonna percuss the liver, dullness over the liver, the spleen. I don't appreciate dullness over the spleen. Did you empty your bladder prior? Tympani over the empty bladder. I'm gonna percuss for the liver span. When I hear dullness, I'm gonna mark. And then to her dullness, I'm gonna mark. I'm gonna measure the liver span. You're about 5 centimeters. I'm gonna light palpate over the 4 quadrant. Any pain?
No.
For any mass or enlargement? I don't appreciate any mass or tenderness. I'm gonna dip palpate. If you have any pain, let me know, okay?
Yeah.
I don't appreciate any mass or any enlargement over deep palpation. I'm going to deep palpate for the liver. The liver is palpable 1 centimeter below the right costal margin. I'm going to palpate for the spleen. The spleen is not palpable. I'm going to palpate for the right kidney with my left hand push up and my right hand dip palpate. And again, I'm going to palpate for the left kidney. The right and left kidney are not palpable. I'm going to palpate for the abdominal aorta. I appreciate the abdominal aorta is midline above the umbilicus, 3 centimeter diameter. I don't appreciate any positive mass. I'm gonna palpate for the femoral artery, 2 plus, bilaterally normal rhythm. Okay. Next, I'm gonna have Bella stand up, just like me with your hand on the side. I'm gonna check Bella posture. I appreciate the slight humps over the back and the shoulder. That's normal, and the hips in good alignment with the shoulder and the knees is lining up with the ankles. That are normal finding. I don't appreciate any kyphosis, lordosis, or scoliosis. Now I'm gonna have you bend forward. I'm gonna check for. I don't appreciate any rib hump or any asymmetry of the shoulder. You can stand back. So negative for scoliosis. Now I'm gonna have you sit on the chair over here. We're gonna do some range of motion of the neck. Okay, touch your chin to your chest. Look up to the ceiling. Turn to your left side. Turn to your right side. Now tilt your head to the left side. Tilt your head to the right side. Full range of motion of the cervical spine. And now push again my hand. Push again my hand. The cervical strength is 5/5 with resistance. Now, can you please stand up? Bend forward for me. Okay. Now, bend backward. Okay. Turn to your left. Rotate to your right. And now bend to your left. And bend to your right. I appreciate full range of motion of the spine. Okay, you can sit down, please. Now I'm gonna inspect shoulder, the elbow, the wrist, and the finger. I don't appreciate any deformity of the shoulder, elbows, wrist, and fingers. No swelling, no lesion. I'm gonna prepare for the shoulder, elbows, wrist, fingers, I don't appreciate any clicks, any swelling, tenderness of the joint of the shoulder, elbow, wrist, and fingers. Now I'm gonna check the passive from flexion, extension, abduction, adduction, internal rotation, external rotation. Passive runs a full range of motion. Now you're gonna do this bilaterally, flexion, extension, adduction, abduction. Put your hands in your back, and now while you're brushing, it's a full range of motion. Now try and push again so the shoulder full range of motion, passive and active, and the strain is 5/5 with resistance. Now I'm gonna check elbow run, flexion, extension, pronation, supination, flexion, extension, pronation, supination. Then you're gonna do this just like me, okay? Flexion, extension, pronation, supination, pronation, full range of motion. Now you're gonna push again my arm, okay? The strain is 5/5 equally bilaterally with resistance. Now I'm gonna check your wrist. Flexion, extension, radiation, deviation, radial deviation, ulnar deviation. Okay, now you're gonna do it. Flexion, extension, radial deviation, ulnar deviation. So full range of motion. I'm gonna try push again my hands, okay? Strain is 5/5 equally bilaterally with resistance. Now with your finger, close, open, and then okay. With your thumb, your small finger in a way, up, and then touch all the finger. Your thumb. Okay, full range of motion. Now try to close your finger. Try to open your finger. Now try to close it. Now you can sweep my fingers. Strain 5/5 bilaterally with resistance. Now you're gonna close your eye. I'm gonna test the sharp and dull sensation. Let me know if you feel sharp or dull, okay?
Sharp, dull, dull, sharp.
Okay, open your eyes. I'm gonna prepare for the brachial pose. Brachial pose 2+ bilaterally equally with normal rhythm. Radial pose 2+ bilaterally equally with normal rhythm. Now I'm gonna check for the bicep, deep tendon reflex. Uh, 2+ active deep tendon reflex. Two plus deep bicep deep tendon reflex. Now tricep, deep tendon reflex. Two plus tricep, deep tendon reflex. Two plus active deep tendon tricep, deep tendon reflex. Brachioradialis, deep tendon reflex. Two plus active brachioradialis, deep tendon reflex. Two plus active brachioradialis, deep tendon reflex. Next, I'm gonna check your lower extremity. Okay, I'm gonna have your hand drop. Actually, I'm gonna have you lay down on the examiner table. I'm gonna check the range of motion of your hips. Okay, you feel comfortable?
Yeah.
Make sure I see it. Okay. Now you're gonna bend your knee. I'm gonna do passive first, okay? Flexion, adduction, internal rotation, external rotation, internal rotation, external rotation. Okay, now flex your hip, bend hip, okay, and do it for the left. Okay, now bring your feet toward the midline, away the midline, and flex your knee and bring the foot toward the midline, away the midline. Yes, do it similarly with your left. Right, away the midline, flex the foot over the midline, away the midline, and then you're gonna face down, like face down, yeah, and then try to move your feet up. Your feet up, the whole feet, yes. Do it on the right first, then on the left. Yeah. Okay, now you can lay on your back, full range of motion of the hip. Now you try to close your hip, okay? Try to open it. The strain is 5/5 equally bilaterally with resistance. Now you can stand up. Sit up on the exam table. We're gonna check the your knee range of motion. Can you bend your knee? Can you stretch your knee? Stretch your knee. I'm gonna push again my hand. Push again my hand, try to close it. Okay. Full range of motion of the knee, and the strain of the knee is 5/5 equally bilaterally. Now I'm going to check your ankle, passive range of motion, dorsiflexion, plantar flexion, inversion, eversion, dorsiflexion. Plantar flexion, eversion. Okay, now you're gonna do it again, okay? Sorry. Dorsiflexion, plantar flexion, eversion, eversion, and now dorsiflexion, plantar flexion, inversion, eversion. Ankles, range of motion, full range of motion. And now I'm gonna try to push again my hand, okay? Strain is 5/5 equally bilaterally. And then I'm gonna check to the feet and toe. Okay. So upon inspection of the hips, knee, ankle, foot, feet, and finger. I don't appreciate any abnormality, any deformity, swelling of the joint. I'm gonna palpate your hips. Can you stand up for me, please? Hips that are symmetrical. Ankle, you can sit down. I don't appreciate any tenderness, warm swelling of the joint over the hips, ankle, knee, and foot and toes. Okay, you're gonna close your eye and let me know if you feel dull or sharp, okay?
Sharp. Dull. Sharp. Sharp. Dull.
I'm gonna check for the popliteal pulsation. +2 normal rhythm. +2 normal rhythm. I'm gonna check for the posterior tibia. +2 normal rhythm. Equal bilaterally. Dorsalis, pedis. +2 normal rhythm, equal bilaterally. Now I'm gonna check for the. I'm gonna have you sit higher up a little bit. I'm gonna check for the sit right here. Patella dip tendon reflex. Patella dip tendon reflex equal 2+ active bilaterally. Now I'm gonna check for the Achilles dip tendon reflex. 2+ active. 2+ active equal bilaterally. Then you can lay back on the exam table. I'm gonna check for the Babinski of the toe. Positive Babinski reflection. Now you're gonna have you stand up. Okay, and you're gonna turn to your this. I'm gonna check for the CBA tenderness. Let me know if you have any pain, okay?
No.
Okay?
No.
Okay. Now you're gonna have you stand up. Okay, now you're gonna walk straight. Okay, walk straight for me. So I appreciate normal gaze, steady, continuous. Now you're gonna work heel to toe, straight line. I appreciate normal gaze, steady, continuous, no abnormal gaze. Okay, you can have a seat. Thank you, Bella. Do you have any question for me?
No.
In this exam, I'm gonna record the findings and I'm gonna develop the plan with my preceptor. I'm gonna come back to give you more information, okay?
Yeah.
Thank you. Have a good. See you in a little bit.